Good afternoon, and welcome to the Board of Health meeting of October 2nd, 2023. Please note this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Healy's March 29th, 2023 signing of the Acts of 2023 extending certain COVID-19 measures adopted during the state of emergency, suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20 until March 31st, 2025, this meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling 508-945-4410, and the conference ID is 329-472-119#, or you may join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Chatham TV, Channel 8, despite our best efforts, we may not be able to provide real-time access. We will post a record of this meeting on the town's website. And I'll turn that over to our chairperson, Noble Hanson.
Yes. It shall be the policy of this board to conduct its meetings under the open meetings law so as to encourage public participation whenever time permits and as part of agenda item discussions. So today we have two items on the agenda, but first we'll establish a quorum, and when I call your name, please say you're here. Carol Boyce. Here. John Beckley.
Here.
Ron Broman.
Here.
Dick Edwards.
Here.
Okay, and we have one alternate, Carol Gordon.
Here.
And Noble Hanson, I'm here. So we have a quorum. And we can go to the first item on the agenda, which is a continuation of a show cause hearing for Matthew Nutting, 130 Old Queen Anne Road, concerning a sewer connection order. And at the last meeting, we had an engineered plan for the sewer connection. We wanted more information, and in your packet is a quote for the actual sewer connection. Is Mr. Nutting here to present the status, or online?
I don't think so.
Okay, so we had wanted to, this had gone on for a while, to make sure that it was finally being done. Mm-hmm. So we were waiting for the hookup construction and the contract we have. And I'd asked Judy, do you know if the contract is signed, or we have a copy of a tentative, contract unsigned?
Estimate. This is all I have. It does say that. Sorry. Yes, I don't know. This is all we have at the moment. It does say that project completion date December 2023. So we can still continue it, and I can try and get the, make sure it's been signed. I mean, this looks like
A proposal.
Looks like a good proposal, but
Estimate, but it's not
yeah,
a signed contract.
yeah, you're right. I'm sorry, I didn't really look too.
No, it's not signed on the back.
No.
No,
Yeah.
there's nothing signed
So-
on either page.
So maybe Judy can contact them and find out whether this estimate has been signed,
Yep,
and if so, what date?
yes, I will get a signed contract and find out when they're gonna start the work.
Okay.
I could look
And so
up-
we would continue the variance for the next meeting?
That's fine.
I think we had decided that
Just
we
keep
would,
keep up on them, yeah.
we would do this right to the end until we had a signed contract, so we know it was being installed, because it has dragged on for quite a bit. So Judy will get more information, and then we'll continue it to our next meeting.
We need a motion to do that? I'll move that we carry this issue to our next meeting agenda.
I'll second that.
Okay, and then we can take a voice vote. All in favor, say aye. Aye. All opposed, say no. Okay, so we'll continue Mr. Nutting to our next meeting. And then, second on the agenda is a continuation of a variance in hearing and approval of IA Technology for Patrick Sclafani, 35 Evans Way, Clark Engineering. Mr. Clark is here. And at the last meeting, the issue was, there were 3 bedrooms on the first floor, and then in the basement, there was a basement family room, which it was questioned whether that qualified as another bedroom, a 4th bedroom. So Mr. Clark continued it, and he sent us a new revised plan, and maybe he can, he's at the podium, maybe he can explain what the status is now.
With David Clark, for the record, from Clark Engineering. So I trust you all have copies of the plan?
Yes.
So what the architect did was open up the landing from the first floor down to the lower level, so that it's all open. So it no longer has the privacy required for sleeping purposes.
So it's open into the garage?
No, it's open into that room.
When you come down the steps, the wall that was at the end of the steps is gone now. So when you come down the steps, you walk right into that room.
So it has no door there.
Well, it never had a door, but it had a 3-foot opening. Now it's wide open. It used to be when you came down the steps, right at the end of the steps, there was a wall and you had to turn right to
Okay.
get into the hall.
Go around it.
And then if you turned left, you went into that room, and that was just the size of a door, so you could put a door on there and have privacy. Now, when you come down the steps, there's a landing and you step right into the,
Right, it's an
I mean,
open,
that's the way I read this, is that.
That's
yeah,
correct.
It's just a landing and you step right into the room.
Okay.
And even though there's a door at the top of the steps, that hall, that hallway doesn't have a door on it, that's down at the bottom.
No,
so-
that door you see on the basement level plan is actually a door to a closet that's underneath the stairs.
Oh, so there is no door at the
There's
top
no
of the
door at
stairs.
the top
Oh,
of the
so
stairs.
that's good, yeah, there's no
Yeah,
issue.
and presumably that opening now at the bottom of the stairs, that's about a 6-foot wide opening, because the stairway width and the hall width together.
It's close to 10 feet now.
So, yeah, I think that was the question from before. Any other questions or comments, or?
It did exactly what we had suggested, so.
thank you.
Okay, so can I get a motion to approve the variance? And a second?
I'll second.
Okay, and we can take a voice vote, I think, on this. All in favor of approving the variance for,
So do you want me to read the conditions?
oh, yes, Judy, please read the.
I mean, it's our standard conditions, but the applicant should restrict the property to a maximum of 3 bedrooms and record the restriction on the deed. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham, through its Board of Health and/or Board of Water and Sewer Commissioners, directs the connection of this property to the town sewer. The signed covenant and deed restriction shall be recorded at the Barnstable County Registry of Deeds, and a copy of that covenant and deed shall be submitted to the Board of Health. Throughout its life, the system shall be under an operation and maintenance agreement. An O&M agreement shall be in accordance with the Department of Environmental Protection, Norrico, Inc. certification for general use dated January 3rd, 2019, modified October 2nd, 2019. In addition, total nitrogen shall be monitored, and a performance standard of 19 milligrams per liter is required to be met. Effluent shall be tested quarterly for the first 2 years, then twice per year, and thereafter, they may be reduced at the approval of the Board of Health or its agent, after the first 2 years, sorry. The applicant agrees to apply a minimum of 6 inches of compacted topsoil to all landscaped areas. The engineer shall submit an engineered as-built plan, including as-built elevations with written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plan of the dwelling or the engineer's site plan without further review by the Board of Health or its agent. And this variance is granted pursuant to Title V in the Town of Chatham Subsurface Sewage Laws, and is valid from 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during that 1-year period, or the variance shall expire.
Okay, thank you. Okay, I think we can take a voice vote on approving the variance for 35 Evans Way. All in favor, say aye.
Aye.
All opposed, say no. Okay, that variance is granted, Mr. Park.
Thank you. Mr. Sclafani also was inquiring as to, he heard rumors that the sewer was been designed for this road and that it was going to be put out to bid shortly. I couldn't find anything on the town's website. I didn't know if the board or the department had any news on that.
When the road would be sewered?
Yeah,
Yeah,
Yeah.
Judy?
Is this off of Morton Road?
yeah.
It is part of an upcoming, I think, phase, but I would think it's probably 5 years away.
Okay, yeah, but there wasn't, I know the town just put a bunch of roads out to bid in August, and, but there was no list of what those roads were.
Yeah, you would have to check with the sewer department to find out
Yeah.
what those roads are. It may be included in that.
Okay.
But so I would think then you're talking, probably minimum 3 to 5 years,
Yeah. Okay, thank you.
so, okay.
Okay, old business, I had a couple things. I'm going to continue working with Judy to set up this informational seminar session. We can have some time to go over Title V, IA technology, the construction, the science of it. And I think Judy had said that the Conservation Commission wanted to be listening in on that too. So we'll put that together sometime when it's quiet. And then I'd ask Judy if there is any follow-up, and I'd like to keep this issue out there on the short-term rental regulation process, your new hires, computer, how you do it.
Yep. We haven't posted the inspector position yet. There's just been a lot of turnover in staff, so they're looking for the natural resource director and the finance director. So I'm hoping that that's gonna happen shortly. As far as the registration form, I spoke with our IT director today. He's got it pretty much ready to go. He's just got to work out some final details on the collection of the fee through credit cards. It's going to be a new process for our department. Right now, we don't accept credit cards. He's going to have to do some training with our staff to learn how to reconcile all that. But hopefully, in the next week or so, we should be able to go live with a rental application. So we're keeping our fingers crossed that we're gonna get that going shortly. And then once those start coming in, our current staff, Lucas and I, and we'll just start looking at them and just trying to keep track of what's going on. I think they're gonna come in fast and furious.
And that's registration through the website.
Yeah,
It'd be on.
through an online portal. It's a program that we use called OpenGov. So,
Question, Judy. So what will the process be upon our receipt of those completed online applications? What then happens in your office?
well, I think to start, we're just gonna, quickly look at them to make sure they're complete and people have signed off on the affidavit. I don't think we're gonna do a lot of in-depth looking at them unless there's something that really glares at us or,
Will you check your records to affirm that the number of bedrooms being declared is consistent with our records?
I guess it depends on how much staff time we can put to it to get going.
That's pretty fundamental,
Yeah.
that you at least make sure
Yeah.
that what they're declaring is what we have. Otherwise, that check and that
I
balance.
mean, we'll do our best to do that. Like I said, it's to get going, we may not be able to check every one, but if we see something that's 6 or 7 bedrooms, we may look more closely at it to confirm that.
Okay.
But,
Will that be within the job description of the person to be named?
yes, hopefully our housing inspector will be administrating, him or her will be administrating the whole program and we'll, hopefully be able to put more time to it. I don't know if you have any interest in seeing this online registration program before it goes live, but Craig has offered to show it to you.
I would like to see it.
I just didn't know if you,
We should know what the public's gonna run into when they go in.
okay,
We
I
may-
can arrange that maybe for our next meeting.
How you would show it at the meeting?
He would come and, you know, he may be doing it remotely, but he would put it up on the screen and show you what it would look like to someone coming in.
The more we talk about it and the more it's out there in the public, the
Yeah.
more response.
And like I said, as far as checking records, I mean, we'll do the best we can. You know, it's,
What's the process for you to do that? Do you have to go into a database? Do you have to go to a folder?
we would have to go and check individual files. You know,
You
we
have to
may,
pull that
and we
block
may
and-
have to pull the septic file, then we might have to pull the building department file. We may have, you know, check that. And also, I usually look at the assessors just to see what they have, although that's not always compatible with what we have, so.
Which one do you find the best, though, to get accurate records? If you want to check on one? Where do you go?
It's usually a combination of our files and the building files, so. And then we have to make some determination based on, you know, best available information. You
Building
know,
file.
sometimes we have something that was built in the 80s and it said 2 bedrooms originally, but it's really 3 or 4, and there's, you know, documentation in all of our files that it is what it is, and we go with the
Building
3 or
file is
4.
assessor file? Assessor?
No, building department, community development, their actual building permit,
Oh.
so.
And then I just one question first. And then is there a way when this new person comes on board that they can also be looking at, or do we have access to the state registration of short-term rentals that the state has taxes, supposedly there's 1,300 and increasing? Will there be a way for that new person to look into that and see if all those people in our town have registered?
I think we
us.
would. That's part of the application. They're supposed to put their state registration number on
Their
there.
ID number?
Yeah.
Okay, so that's a good cross.
Well, I'm concerned that if we grant a approval of a registration, that for a 4-bedroom house that's really only has a 3-bedroom septic system, then we have done that. And then to withdraw that the following year is conceivably a big problem.
Their
So I
permit,
don't think we want to be giving people,
their application is gonna say what you were approved for on your septic, what your septic is approved for. That's the question. So they have to confirm that themselves. If they are wrong, then they're attesting to that. They're signing an affidavit to all of this information that's on the form. So
well, how do they know?
they can call us.
How do they know? That, you know, that, to say that everybody has to call you, well, then that's gonna add more business.
A
You
lot
know,
of
I mean,
people-
the
a
least
lot
we
of
can
people
do
already
is
know,
go to the
believe me.
online database, the map, and find out what the you know, and, you know, you give me somebody's name and address, I'll tell you in 30 seconds what the assessors say they have for numbers of bedrooms. It's right there.
But that's not always accurate.
I know it may not be completely accurate, but if that says 3 bedrooms and they're asking for 5, then we need to look further. If it says 6 bedrooms and they're asking for 3, then I don't think that's a big problem. But I just fear that people are, you know, that if we don't even look at if half of them don't even get looked at because we feel we have to go and get the public, you know, the sewer records and these records and those, so we just say, let's give them.
Well, I mean, when
approval.
we started this, and John and Noble, I mean, this was a data collection process to start. And then we can compare, we start getting complaints, you know, overcrowding, we can look at those properties. You know, we need to let the registrations get underway, and I just don't see how it's gonna be feasible for us to check every single one
Let me just ask, so. the
right off the bat.
the Registration form, they fill out and pay a fee, but then is there some formal acceptance of what they
Yeah,
say?
that was my question.
I don't think so. We just take it in and they're.
Well,
Does the
we're,
applicant hear back that somebody here has
they'll get a
okayed it?
printed permit, they get an actual printed,
Permit?
yeah,
So we have to authorize the issuance of that permit?
right.
Okay, so they are in a
But it'll be
sense,
based on what the information they tell us.
They sign it?
So if that's
we should be
inaccurate,
checking, because we're affirming at that point, by issuing their ID number, that everything is hunky-dory with the application. in terms of,
I mean, I'm not confirming that they have a smoke detector on every floor of their building, or that they have adequate parking or sewerage, well, sewerage, I guess I would be, but,
but I think the kernel of our issue, at least for me, is the bedroom.
Right, that's the whole reason
Yeah.
for this registration.
Well, I
is to
think this
limit-
is-
to prevent people from renting a house and advertising a six-bedroom house when their septic is for four bedrooms. And I think the least we can do is look at the assessor's record. And if you want to give me 100 or 300 names and addresses, I'll tell you in 2 days what the number of bedrooms in the assessment is.
yeah.
That's
I mean, I
easy.
think at
That
the
takes
minimum,
no
we can
time
do
at all.
that, that's
We
easy
could
enough.
divide it up among the committee, we could just,
And that's something we could do ourselves in,
at
30
least we
seconds.
won't be giving somebody a registration for 6 bedrooms if they're assessed for 2 bedrooms.
Judy, when you have stated in the past that there are times when there are times where there's not agreement between the health department records and the assessor records, is there a tendency of which one's higher or lower? I mean, if
We're usually higher,
we're usually higher.
Yeah.
If there's a conflict, usually our numbers are higher than theirs.
yeah.
Okay.
Sometimes the house hasn't been actually looked at by the assessors for a number of years, or
Okay. So they're catching
or
up with
they've
us.
got a room that, when they went and assessed it, it had, a couch and built-in bookshelves, and they don't call that a bedroom, even though we would,
Okay.
know.
They're assessing the current use more than its
Yeah.
potential use.
I don't want to speak for them, but
Right.
yeah.
That's,
They're not as concerned with number of bedrooms. They're looking at square footage of the dwelling itself,
okay.
so,
That's their priority.
yeah.
Carol?
Isn't there a way that the new person being hired could just be assigned to cross-check between the applications coming in and the assessors? And that would just be a part of,
I think that could be
Her job.
easily done, yes.
Yeah, just
Assessor's
crisscross, yeah,
information.
to check if
As at
it's
least a baseline check, so we can certainly do that.
Ron?
Judy, when they sign that thing, that's saying they are
Attest.
firm, attest
Right.
to how many beds they said. So it would be their fault if
Right,
it's wrong.
But if
That's-
we
that's
proceed and issue them the ID number,
Yeah.
then we are de facto
Yeah, if we don't catch them, at least.
saying that we agree
Yeah.
with what
He
they
said-
said.
but we're taking their information.
I think there's a significant proportion of homeowners who don't know what their sewer plan is.
Septic plan
And what,
is.
and how many, so.
I agree,
so
though,
if
we
you-
will get calls. People
you know,
will
if-
call to
if-
ask.
If they say they bought a house and that house has 4 bedrooms, they think it has 4 bedrooms, and then somebody comes back and says, well, you only have a septic system that, for 2 bedrooms, that would be a surprise to them, you know?
Right.
And to say, well, they're liable for, what you would be saying is that everybody, before they fill out this form, has to go and check on their sewer records, their septic records.
They should.
Yeah.
Well, that's
Well,
their
then- well,
responsibility.
then you're gonna get 1,000 calls to look up the
I
septic
mean, we've
record.
probably already got half of them already, because people know this is coming, and people are calling us and asking.
Are they doing that right now?
Sure, I mean, we get, how many calls a day do we get? Not specifically for short-term rental, but for, information on number of bedrooms, yeah.
Is there a way to qualify the registration that you get this year, that it's based on what the owner states? So that later on, when it gets checked or something, we can change it or retract it?
Yeah.
At least
Well, why don't
as we're ramping up, because it's gonna take
I can,
a while for this really to get smoothly working.
I think what, if we have Craig in, and present it to us, you can see what it looks at, what the questions are, and we can tweak it if you have any major concerns, but, I mean, we certainly can check the assessor's records for everyone that comes in. It's a matter of 3 keystrokes on a,
and this is an annual registration, right?
Yes, yes.
So if we don't catch it now, they have it for 1 year, but they may not be re-registered again if we see that something's off, right? It's not like a permit
Yeah,
forever after.
Dick's concern is, have we already issued it? But my question is, can we make some statement that the issuance of it is based on what the owner says?
Oh, I think that's in
It'll be-
there. It's an attestation that this
And
is,
then it's an ongoing process.
right, right. So, we can,
So this is, so we got
What's our next
October, November,
Board of Health?
December, January. So there's 5 months.
October 16th, that's in a couple of weeks, so,
We need to hire this person.
How long do you estimate, I know this is an unanswerable question, they say the job market, how long do you think it'll take to hire somebody, just as a guess? When do you think they'll actually post the position?
I don't know.
Don't know.
It's hard for me to say. They're,
So where is the bottleneck with getting the posting?
I think it's with human resources.
HR.
I think they're, like I said, they're hiring a natural resource director, a human resources assistant, finance director. So,
Yeah, but it's not that hard for them to post it, though. It's not like they gotta find,
Who's
it's
head
not
of,
like they're out there to,
our human resource director is Megan Downey. So, she's my other half of my brain.
well, but
well,
But if she gets the thing posted, and then we have some inquiries, that's where you get involved, it would seem to
Oh,
me.
yeah.
So they don't have the burden.
I'll push it. I mean, I've been reaching out routinely with.
Why don't
I
you,
would just stress, our registration deadline is what, March 1st? March
Yes.
1st, right, so we've got, what's that, 5?
I'm just concerned because, well, I want to get the registration open because I think people are planning for next year and they
Okay.
need, they need to have
Many
this.
have already
reg-
rented.
Right, so,
well, they may or may not have to adjust, right?
right, so,
But-
so I want that going and I do. I mean, we're going to need the staff person to get this.
Well, why don't you go back to her, the HR director, and say the Board of Health is very concerned about this
Yeah.
new position not being filled. Whatever, they've asked me to ask you to please expedite.
Yeah.
Would a letter from us or something be helpful or hurtful or unnecessary?
I don't think so. I mean, I don't think it would help at this point. Let me just reach out to HR and Jill and Katie, who's the acting natural resource director, and tell them that the board discussed it and they're
This
anxious, yeah.
whole new initiative
Right,
is to some degree dependent upon the staffing getting.
right. The success of it definitely
Yes.
depends on having a good staff person, so.
Right.
And it's a good position. I mean,
What's the salary gonna be, do we know?
it's a greater than $60,000 a year, so.
Really?
Yeah, I mean, 65,000 or something. I can't tell you, it's
Right.
certain grade and
They
step
stay
on.
slided in?
Yeah.
Okay.
With benefits, so it's.
All right, so that's not like a bare minimums. I mean, that's a decent,
Yeah, it's a good starting position for someone, getting into the field, so, we'll see. All right, I'll push it, I'm gonna push it.
Okay, well, I think I'll bring this up for an update each meeting, so we can keep it up on the topic.
Good.
And I think everything we've said is pertinent, and, the issue has come up before that this initial registration and how we do it or don't do it will have an impact on how well it works down the road, so it's, I'm sure Judy's working hard at it. Okay, and then, I was going to ask Judy if there's any, COVID update statistics, or at least.
I don't have any statistics. From what I understand, it's starting to level off somewhat. People are expecting a surge again in the winter, but things have kind of leveled off. I'm sure you all know someone who has it right now, who's had it recently. So I don't have any particular numbers. I can tell you, we have 2 clinics scheduled, which we're hoping we're going to have the COVID, but it's flu and COVID. October 19th from 10 a.m. to noon. It's a drive-through, and the online registration is available through a link in the health page, in the health website.
now, is this for, are you gonna have COVID?
We're going to have COVID, hopefully. But
planning on
you
having-
can register for both, COVID and flu. As you know, the COVID has been approved. It's a monovalent. The bivalent is not available anymore. This new vaccine is the only one they're offering now. So,
If your insurance doesn't cover this, can you still get the shot?
yes, the town will
Okay,
absorb.
good.
But I think most people's insurance will cover it.
Well, I'll tell you, I'm having a problem. I'm Medicare, and I got turned away by CVS because,
The pharmacies are charging $190. They're saying insurance doesn't pay.
For COVID?
Yeah,
Okay, well, that's interesting. I'll have to speak to our VNA people.
see, I have Aetna Medicare PPO, which is a form of, it's an enhanced Medicare coverage, Aetna. I went to CVS on my duly timed date and time, and they said, "You're not covered." And I said, "You're kidding me. It covers everything." No, you're not covered.
I have the same insurance, and I'm scheduled for my shot. I have the same insurance, and I'm scheduled for my shot next week at CVS, no
You're not gonna
problem.
get it.
Well, they gave me I put in the insurance information, and they gave me an appointment.
Well,
I've heard
And-
of others that have been
They told me-
they
I will
pay
check with
$190.
VNA. I mean, they're the ones that do all the insurance company billing, so they would be on top of this, so
The
I'll double check with them.
CVS I was standing at was the one on 137 in East Harwich. And the woman had the screen up, she goes, "This is not going through, it's not going through, you need to bring this card."
Medicare Part B?
She needs to see the Part B
Right.
on this, and I don't know why this is no good. Dick, you may know, but
What's that, your?
I think it is covered under the Part B. That's
it is.
usually what we
It
put
is, but
down.
why wouldn't that PPO Medicare coverage go through?
Because Medicare Part B is covering it, so that's the number they put down. I know that's what, when I would do this,
Exactly the same thing I have, and mine, they had no problem. And I'm sure this covers it. There's some problem with when they did that. I mean, this covers everything.
Right. So I had to go today to my bank safety deposit box.
You get the $190?
No, you get the $190. No, but I had to go there and dig this card out of my box in order
What's the card
to.
you're holding up there?
the Medicare Part B.
I had to dig this out, and now I got to make another appointment, or I come to Judy's.
Yep.
But
But Judy, let me ask you, so if you register for this clinic, you register online with the town? Does the town follow up and check with your insurance as to whether it's covered or not?
No,
Or
it's
is it
through, it's all
automatic?
through the VNA. It's an online registration portal through the VNA.
Do
And
they check, or do they
Where
check
do you
insurance
find-
coverage and cost, or is you just automatically get it basically for free if you go to the clinic?
They will check insurance. They ask people to bring their insurance card.
no cost, we cover where they can, and they write
Yes,
off the
they-
rest.
They,
Okay.
right.
So, and then, now, is there just one clinic or two?
There is another clinic, but it's for, right now it hasn't been open to the general public yet. It's for town employees, school employees. You folks would be included as town employees and committee members. On October 26th from 3 to 5 PM. We're going to get school-age kids. It's the annual town employee and Monomoy school system that we do.
So
been
how do
doing
we
it.
do this online registration? Where do we find that?
So you go on the,
Town website.
the one on the 19th is on the Town Health Division website. There's a link there on the left side. It says Flu Clinic, October 26th. Click on that. It brings up a folder, a poster with a link in it. And you click on the link, and that brings you right to the... It's pretty simple. If you have any issues, if anybody has any issues, they can call the health department, or they can call the council, the Center for Active Living, otherwise known as the Council on Aging, and we could help with that. But it should be, if you go in through the link on our website,
Take you right there.
yep.
Okay.
Now, Judy, is it likely that you'll have another set of clinics later? You don't know, not necessarily.
Unless we see a strong demand for it, and historically, for the past few years, we have not, because,
right.
you know,
That's a nice operation there at DPW.
yeah, it's been great,
Yep,
so,
nice, open,
yep, drive right through.
drive through,
real
rain or
quick.
shine, everything works.
Yep, and we get the CERT team members are our volunteers, and they
They
do a
get to
great
do
job.
something that's important.
Yep, it helps them practice and,
Yep.
yeah, so they're
They
there.
get to wear their vests.
Yep, they're awesome. That's a really great dedicated group of people.
You know what's true? These CERT teams are in every town,
Yep,
every state. We had one in New Jersey, same thing. Wonderful.
yeah,
Come out whenever asked, with a smile on their face, wearing their vests.
yep. They work hard. And we have, ours is Chatham, Harwich, Brewster, Orleans, I think.
Mm-hmm.
I should know that.
Okay, any other old business or new business topics somebody would like to bring up? If not, we can go ahead and approve the minutes of September 11th. Does anybody have a revision or a comment about those minutes? If not, I can get a motion to approve.
I'll make a motion to approve the draft minutes of September 11th.
I'll second that.
Okay, and then we can take a voice vote to approve the minutes of September 11th. All in favor, say aye.
Aye.
All opposed, say no. Okay, so those minutes are approved of September 11th. And I think we can go ahead and close the meeting. Can I get a motion to close the meeting?
So,
So move.
Okay, all in favor to,
Second?
second?
I'll second it.
Okay.
you just
All in
want your
favor?
name in the minutes.
All in favor, say aye.
Aye.
Opposed, say no. Okay, the meeting's adjourned. Shut off our mics and discuss outside.